A cancer diagnosis is devastating, but there are many benefits to catching the disease early. Often it means more treatment options, including less invasive ones, and a better chance of beating it. Over the next 3 days, we'll be looking at screening programs in Ontario for 3 different forms of cancer, what they involve and what they can reveal. CTV's Krista Simpson joins us now with this special series. Krista.
Well, Nancy, we'll start with one of the most common forms of the disease. Breast cancer will affect about 1 in 9 women, and early detection can make a big difference. We look at that in part 1 of Cancer Screening.
You've reached that magic age of 50 now.
That means it's time for Carol Kingston to consider a mammogram, a low-dose X-ray looking for signs of breast cancer.
A mammogram will find a cancer 2 to 4 years before we could feel one.
Screening is asking you, asking you to take a test when you don't have any symptoms of the disease that we're looking for.
Dr. Rachel Halligan uses something called a thingamaboob to show what can be seen on a mammogram.
So this is basically the size of a tumor, the size the tumor must be before you might be able to feel it.
And even then it may be hard to find if the breasts are large or the tumor is deep.
The very tiny one up here, you may not be able to see it. That's what we can see with a mammogram. Again, at this stage, much more likely to have spread into the lymph nodes.
Motivation for Kingston to get a mammogram.
The screening is recommended by our experts every 2 years for women between the ages of 50 and 74 who are at average risk.
Average risk women are defined as those who do not have symptoms such as breast lumps, do not have a parent, sibling, or child with breast cancer, and have not had radiation for another cancer at a younger age.
A mammogram is not without risks. In particular, it does require exposure to a small amount of radiation, but it's often something else that keeps women from taking the test.
I think the biggest concern is pain.
So what we're going to do is take 4 pictures, 2 of each breast, 1 from top to bottom and 1 from side to side.
The breast is placed on a plate, a paddle comes down,
And just try to relax as much as you can.
then the squish to capture the images.
And hold your breath now, Carol.
3 more times and Kingston's done.
I wouldn't say painful, wouldn't have been the word. A little bit of discomfort, but it was so quick and in and out in 5 minutes.
The radiologist will look at your mammogram tomorrow.
Sometimes women will need more testing to look at a specific area, but that doesn't necessarily mean there's a problem.
Most of the time when women get called back, it can be resolved with either the extra squish, the extra pressure, that we call spot compression views in medicine, or with an ultrasound.
A false negative test is also possible, meaning a concerning sign is missed. The bigger concern, women in their early 50s who avoid the screening.
I don't know what the reasons are. I can only imagine. It's a pretty busy lifestyle. Maybe you don't think you haven't really met a lot of people. It hasn't been happening to a lot of people around you at that point.
For Kingston, it was important to get hers done.
Because I've had friends who have had breast cancer, I've lost people due to breast cancer, and it's 5 minutes to get the test done, easy, and then I'm feeling better, that I know that I'm healthy and I'm doing what I can to prevent anything.
If Carol Kingston's test is fine, she'll get a letter in the mail letting her know that result through the Ontario Breast Screening Program. They'll also give her a call in a couple of years to remind her that it's time to book her next mammogram. Tomorrow, in part 2 of this series, we'll look at a simple screening test for colon cancer.
This is a cancer that can be easily picked up early, and if it's picked up early, we know that it has a very high cure rate. So if picked up early, probably up to a 90% cure rate.
And for that test, you don't have to go to a hospital or clinic to do it. It's actually done in your own home. Nancy.
Thanks, Krista.